Next, we have Dr. Binuja VA, who will be talking detection of early glaucomatous damage in PXF syndrome by assessment of RNFL thickness and IOP.
Good morning. Detection of early glaucomatous damage in pseudoexfoliation syndrome by assessment of retinal nerve fiber layer and intraocular pressure and observational cross-sectional study. So, pseudoexfoliation is a systemic condition. The incidence of pseudoexfoliation increases as age advances. Genetic and environmental factors predispose to pseudoexfoliation syndrome, like exposure to UV radiation, climatic condition, and proximity to the equator. This study is conducted in the district of Alappuzha, a coastal place where there is an increase in the incidence of pseudoexfoliation syndrome among elderly. So, why I chose this study? Pseudoexfoliative glaucoma is an independent risk factor for RNFL damage. More than 60% of patients have abnormal RNFL 5 years before the occurrence of visual field defect. Hence, the importance of detection of early glaucomatous damage using RNFL thickness even before visual field defect may help in early diagnosis so that treatment can be started as early as possible. So my objective is to find the relationship between pseudoexfoliation and retinal nerve fiber layer thickness and the significance in detecting early glaucomatous damage. The secondary objective is to find the relationship between PXF and diurnal variation. So methodology, the patients I used study population of age group 60 years to 80 years attending ophthalmology OPD at tertiary care center. It was a hospital-based observational cross-sectional study and I used non-probability sampling. The study period was 1.5 years. The sample size were 57 eyes. And inclusion criteria, all non-glaucomatous patient who belongs to the age group 60 to 80 years with pseudoexfoliative syndrome, both bilateral and unilateral. The exclusion criteria include media opacity interfering with visualization and OCT image capturing, history of any ocular surgery or any retinal diseases, those who refuse to give consent, diagnosed case of any type of glaucoma, and other causes of optic atrophy. The study variable include visual acuity, proper slit lamp examination and fundus examination, intraocular pressure with applanation tonometry and diurnal variation, and OCT evaluation using Cirrus ST OCT. Coming to the result and discussion, the demographic variable, that is age, out of 38, 27 belongs to 60 to 69 and the rest 11 belongs to 70 to 79. Even though pseudoexfoliation relatively common disorder in older individuals in southern India, the increase is multifold. Hence, I chose the elderly age group between 60 to 80 years as my inclusion criteria. Coming to the gender, the female to male ratio were 1:1. Even though some research have said that female preponderance was more, but in my study, out of 38 patients, 19 were female and 19 were male. Coming to the intraocular pressure and diurnal variation, in my study, 19 out of 57 eyes, the IOP was 16 and 16 out of 57 eyes, the IOP was 14 and the mean IOP was 16 mmHg. In my study, there were no significant diurnal variation and the mean variation was 2 mmHg with higher IOP value recorded in the early morning hours and maximum variation of 6 mmHg was seen only in one eye. In the present study, I use Cirrus ST OCT to measure RNFL, and according to study by Apokut et al., the normative data of RNFL was taken among Indian population and I use this as my reference value. The superior RNFL thinning in my study was observed in 22.8%, inferior RNFL thinning was seen in 33.3%, temporal thinning was seen in 35.1%, and nasal thinning was seen in 17.5%, and the mean RNFL was seen in 82.5%. All four quadrants shows a significant RNFL thinning among pseudoexfoliative patients, and my study shows that patients with pseudoexfoliation show diffuse RNFL thinning without any specific sectoral involvement. Hence, from my study, it was shown that RNFL thickness assessment using ST-OCT in monitoring optic disc changes of individuals with pseudoexfoliation can aid in the early detection of patients at risk for glaucoma. To conclude, OCT RNFL assessment with Cirrus ST OCT can be used to assess RNFL changes in pseudoexfoliative syndrome. There was noticeable RNFL thinning which was diffuse in nature. There were no sex predilection noted. No significant IOP fluctuation was detected among pseudoexfoliative patients. An early detection of pseudoexfoliative patient by assessment of RNFL thickness using STOCT is essential and should be included in screening method so that treatment can be started to prevent further glaucomatous damage, since pseudoexfoliation glaucoma has a very rapid and aggressive course. So coming to the limitation, the sample size was less than ideal. The diurnal IOP variation was very difficult because of the nighttime patient was often woken up from sleep, and the majority of the patient has cataract, and that made my OCT very challenging. So these are my references. Thank you.
You admitted all the patients for 24-hour IOP?
We used to keep them in OR, sir, observation. Or we used to, that was a problem in my study because majority of them was not ready for screening purpose, but
But you can't measure means it should be out of the study.
yes, yeah.
Number one. And number two, you said what was the problem, another problem in limitation?
That they were often woken up from this sleep. Yeah. Small size, yes, sir.
That only number will reduce.
Yeah.
Or is this only where you could calculate?
No, that because of these things only my samples. Ideally, there was extremely large amount of people
So it has
who
not
has.
worked on the incident value.
No.
But generalized.
Yeah.
That is good only, but you have not followed up over a period.
Yes, sir. That is one of the recommendation in my study. I need to follow up this patient more.
Good study.
Thank you, sir.
You're told now the mean value of 16 millimeter mercury.
Yes,
But
sir.
once area you are told 16, other area you are told 14. From
Yeah.
where did you calculate this mean?
Mean I took the average.
Average, then even if you calculate average, it may not be perfectly 16. How can it be? Few cases you have shown 14, man.
Yeah, few case that is in my out of 38, 57 eyes, two group that is 16 was the most highest value.
That's okay. Some are having 14 also.
Yeah, yes, sir.
Now you calculate everything and divided.
Yes,
Is
sir.
it 16? Around 16?
Yeah, 16.
Sure,
Yes. Yes, sir.
definite.
Yes, sir.
Then you told pseudo exfoliation. Is it a correct term or something different?
Exfoliative.
Exfoliation. What is true exfoliation then?
True exfoliation is delamination between superficial layer and deep layer, which is seen in lens surface. It is otherwise observed in glass bowlers. Okay.
Which is the radiation there? Which rays?
Infrared radiation.
Sure.
Yes, sir. Infrared exposure to high infrared radiation was one of the most
How can
common.
they affect a lens, man? Whether it's in between you got IDs and all is there.
In lens, it causes zonule. It can affect the zonules. So
I'm not even asking pseudo exfoliation. I'm asking you true exfoliation.
true exfoliation lens. Uh,
How the infrared radiation goes and affect your that lens capsule?
it will.
Yes. For fun, because we want to assess whether you know something or not. For exam purpose. You have finished your exams? No.
No, I am going to
Because I
write.
may come as examiner.
Your thesis presentation,
Yes, sir. This way.
you are allowed to present before your exam.
Yes, sir. I have already published in case.
No, because
Published also.
I mean, we are already submitted.
Submitted.
Yeah.
Accepted.
It is coming in one or two. MS.
because we may come as examiner for you. So something questions are released now. You tell me how that infrared affects your lens.
Okay, so that mechanism correctly.
See, it is absorbed by the pigment epithelium of the iris and the heat is liberated. That's all.
Okay, sir.
Okay.
Okay.
Thank you.
Thank you, sir. Thank you.
Very expressive presentation.
Thank you.
Okay. And what is the normal RNFL thickness?
Normal RNFL, it is around a range of 103 to 105 in superior and in inferior. But in nasal and temporal, it is normally is around 93 and 80. I mean, nasal, it is.
Whenever you are talking about abnormal things,
Yeah.
you have to show normal also.
Oh, yes.
Compare and
Okay.
we are learning for the audience.
Sure, ma'am. Sure.